The number one mistake people make when they're wanting to change careers, especially when they start thinking about medical device and pharmaceutical sales, is there's basically only two options. You're going into orthopedics for the medical device side, or you're going and becoming a pill pusher on the pharmaceutical side. And there's so many different layers and columns of different positions within these environments that nobody necessarily thinks about. So what I'm trying to do within this new series is have conversations and side interviews with people that are in the industry of these different roles, so that when you guys are doing your research and you type into Google or certain key phrases, something else pops up, because there is a lot more out there than just your orthopedic device roles as well as your regular pill pushing pharmaceutical roles. For example, what I want to talk to you guys about today is capital equipment sales for a life science research company. What is wild about this, after having the discussion with this person, was this company had a requirement of 5 years of experience to be able to do capital sales with them. And it's because they have a really nice base salary, especially for, I wouldn't consider this an entry-level job, but speaking with them, this is the entry-level sales role for capital sales. So 5 years of experience in capital sales, like, it's hard to get those 5 years of experience. So what I wanted to highlight is this specific person got in with zero experience within capital sales. So don't let that deter you from applying to these roles when you see them, because you going in, having the confidence, understanding what the product is, and also getting some coaching if you need it. Not from me, this person got coached from the actual recruiter, and that really helped them throughout the process. So kudos to them. I've mentioned that multiple times for myself, recruiters have not been that great, but they found this role on medreps.com. I've told you guys about that website before. Definitely don't sleep on it. I wouldn't necessarily keep a subscription for a very long time, but if you're looking for a new job, it's a great place to start looking at an area that has all of those jobs kind of consolidated into one section within your region, within your state, within your city, something like that. And what's nice is you are able to look at all those different roles and also find the recruiters that are looking for basically, you, and you can start reaching out to them on LinkedIn and trying to just get more information from them that way, getting in front of them, and different avenues like that. But I would definitely say medreps.com is a great place for people that are just now in the industry looking to find a new role. For myself, whenever I look for a new role at this point with the amount of experience that I have, that's definitely not a place that I go to, but it's definitely an awesome stepping stone for people that are not in the industry already trying to find a new job. And so, as I mentioned, zero experience, but this being a research-based capital sales role, this person did have research in their background from their 4-year degree. So it did require a 4-year degree, but those were basically the only two requirements, and he only had one of those requirements. Then, when it comes to this specific role, what's actually really cool is it's transitional research from animals to human trials, which I think is awesome. I've never worked in anything like this. I like these types of roles because they teach you a lot of what's going on in the background, especially in the role that I'm in now. I'm in oncology sales, so he's seeing these clinical trials going through and how they work their way through that process. And the call points here are going to be your pharma companies, your CROs, your academic research centers. He's also calling on military institutions. And the caveat to this, or the catch-22, is these are large geographies. And the reason for that, he covers 8 states. And the reasoning is when you're in capital sales, it takes quite some time to make a sale. You can start having a discussion with an account on day 1. They might want to buy it on day 2, or even a month from now, or 3 months from now. But it all also depends on how long it takes for them to pull those funds together. Sometimes they have private funds and they can go ahead and purchase that stuff almost immediately. That's an awesome win right there. But if not, he, in this role, is also helping them sign up for grants through the NIH or through pharma companies and different things like that. And so that takes time. I definitely learned that when I was in capital sales, and then also when I was in healthcare tech sales. That was one of the determining factors of how quickly you were going to get paid on something. You could have great discussions with so many different people and everybody wants your product, but if you're waiting on a grant, 6, 7, 8, 9 months, that really sucks. And so that's why, again, I'll get to it here in a little bit, the base salary is pretty awesome for this role. Now let's go back to the 8 states piece. My personal opinion, if you have a family, kids, and they're on the younger side, this is probably not going to be an awesome role for you. And I say that because one of the reps that just started in the same role that I'm in only covered 3 states, and they had, I think they mentioned like 150 plus nights in hotels. That's almost half a year of your life spent in hotel rooms, not even your own home. So if you have a family, that would mean that you're spending half the year away from your family. That doesn't even include all the amount of hours that you're driving when you have these larger territories going so far away, even for just a quick day trip. So you definitely have to keep that in mind when it comes to this. The types of companies that you can be looking for if this role entices you would be Harvard Bioscience, which would be considered the gold standard. Then you also have Fisher Scientific, which is also another very reputable company, but in a different niche. You've also got MCA Technologies and Star Life Sciences. So if this is something that you're interested in, there's 4 companies that you can start at least researching, looking at their organization and seeing what kind of openings that they have. As I mentioned before, don't let your experience deter you from applying for those roles. This particular person, they went through 3 interviews and got hired on pretty quickly. So that's a best case scenario. Sometimes it could take a lot longer, so just keep that in mind. And then the compensation, which you guys have all been waiting for, I think awesome when it comes to an entry-level role. This compensation package is 120 base salary with on-track earnings of 180. On-track earnings meaning what they would expect you to be reaching if you sold 100% of your quota. So you're talking entry-level role, you're coming in straight out of school, 4-year degree, and you could be making $120,000 as a base salary. A lot of people right now are saying that $120,000 is basically almost the new standard that you need to be making as a millennial to even have a normal life. So I think that that's really amazing. They also get a car package. Obviously, their travel and everything is compensated and taken care of. So if this is something that you're interested in, there you go. Capital Sales, don't forget about it. Don't sleep on it. This is specifically in the science and research side of things. I've got more videos like this coming out, so keep on the lookout for those. And good luck to everybody out there interviewing in this new year. And, more power to you if you're trying to change your career and do something different and taking a chance on yourself.